Hi, Professional Co-op members. This is Dr. Bill Beaky, Director of Professional Co-op, and we have another in our series of interviews. And this time we're very happy to have Dr. J Dunn with us. And she is the author of the book Holistic Kinesiology, and she's the creator and innovator of Holistic Kinesiology, a teacher and lecturer. And for over 29 years, she's researched, practiced, and taught this technique to hundreds of individuals who, like her, are on a quest to find an alternative solution to allopathic medicine. And boy, is that ever truer than ever in this June of 2020. So welcome, Dr. J Dunn, to our interview.
Thank you so much, Bill. It's great to be here. I appreciate you.
Oh, thanks. And we have you here because you have done some really fabulous work in genetics and methylation, and that's kind of a buzzword with just about everybody at this point. Everybody wants to know a little bit more about genetics, what's our makeup, and how these things work or don't work. So why don't you start by giving us a little history about yourself and some insight into your professional journey as a chiropractor.
Okay, thank you. I started out as a kinesiologist. Unlike a lot of chiropractors who start out as chiropractors and learn kinesiology, I was exposed to kinesiology through a chiropractor who did it on me, and I just was blown away by the things that he could tell from my body and the results I got from him versus going to any other practitioner I'd been to. So I got pretty darn excited about it and wanted to know everything I could about it, and studied that and became a kinesiologist first. And so I haven't practiced since 1988 is when I started practicing kinesiology, and had a really thriving practice, and then decided to go on to chiropractic and went to Palmer College in Iowa. But the combination for me is incredible, and it's just my first love. Kinesiology is just incredible. I don't know how people live their life without this tool, this diagnostic tool. So I studied with so many different practitioners, including, our good friend, our mutual friend, Wally Schmidt was a big mentor of mine. Chris Smith. My teacher was Kartaperg Singh Khalsa, who had studied with Beardall. So my lineage, came down to Goodhart, Beardall, and then my teacher. So I've got a combination of techniques that I put together, and probably like a lot of people who do kinesiology, I had my own style, which was a combination of all these different kinesiologies. And so in 2000, I broke away. I was teaching for my teacher at that point, the Kinesionics Institute in 2000, and I decided I wanted to add in some new techniques. He didn't want to go there, and so I decided to just go ahead and create my own technique, and wrote the Holistic Kinesiology book, started the Holistic Kinesiology Institute in Albuquerque, and started teaching people. And another area of a little bit of a rub from some AK people was that I was teaching lay people how to test. But to me, it was just very empowering for them to know how to work with their colds and flus and tummy troubles. And then when they got to more advanced needs, healthcare issues, then, seek out somebody who's got more information and more knowledge. So that didn't always go over well with the powers that be, but I'm very passionate about that, empowering people to understand their own bodies and take care of the little things that come up. So go ahead. Yeah.
We'll add to your pedigree, which is quite impressive, that you are also a maverick.
Yeah, a little bit too much at times.
Well, that seems to be, everybody who develops something new and useful has to take a step outside the box, and you can't be afraid to do that sometimes. And I can tell you that what I know of your program so far is pretty impressive. So I think you made a change for the better, and gathering information from others and then using it and collating it and putting it together in your own way is a kind of a hallmark of some of the people that we deal with who are really at the top of the class.
Well, it's funny that you would mention that, because as I've gotten into genetics, there are genetic variants that are really associated with that particular quality, personality. And the majority of chiropractors, especially kinesiologists that I've met, I look at their genetics and I'm like, yeah, I can see where this came from. There's a gene called the DRD3 gene, and it's a dopamine receptor. And across the board, it's associated with entrepreneurship and, you know, sort of this maverick, this sense of, you know, I can do it better. I can figure out a better way to do this. Is pretty, you know, it's pretty much straight across the board with this group. You know, I'll ask the question, do you guys have trouble working for somebody else and really like following the rules? And they're like, yeah. So it's there in the genetics. It's kind of interesting.
Well, we'll get to a little bit more of that shortly here, but genetics and methylation have been your forte for quite a few years now. And was there a mentor or an inspiration that brought you into this sector of medicine?
Well, that's a good question. It was looking for better answers that brought me into it. I still had, you know, some patients. I had a lot of techniques in my bag that are amazing, and I was getting some incredible results. My practice was, I had a waiting list practice. You know, people waited sometimes a year to get in, but I still, you know, I questioned, like, what am I missing? There are still people I'm not getting well, and myself included. The chronic fatigue syndrome that I had, you know, a lot of people didn't know I had it, and lifelong depression that I had that I concealed very well, followed me around and made me wonder, like, what am I missing? There's a piece missing. And, you know, genetics was, you know, as you kind of mentioned or alluded to, genetics was hard to get our head around because it was, you know, we didn't know how to work with it. We knew that it was there and it was probably, okay, well, it's got to be genetic, and we just kind of pushed it aside. But since the advent of the Genome Project, we started to know how to work with this. And Amy Yasko, I studied her work. Rich von Konynenberg was one of the first videos I watched that just blew my mind. And I was like, wow, this is it. This is the missing piece. I knew it was. I got chills. You know, I know when I'm on the right track when I get chills. And I was like, yes. You know, it just spoke to me about the patients I wasn't getting anywhere with. It spoke to me about my own chronic fatigue syndrome, my own depression, and I was like, I gotta figure out how to do this. So I put together the kinesiology, you know, all the biochemical work that I've been studying. I studied at the Institute for Functional Medicine. I used that knowledge. Chris Haskell-Smith, I had learned a ton of biochemistry and kinesiology from him, and started to stick it all together and in, you know, a combination of kinesiology, biochemistry, genetics, and this thing started to happen, and it was like, wow, we can really get in there. We can get in there with the kinesiology and understand how it relates to nutrition and diet. And, you know, we can really make some changes with just supplements and diet changes, and it changes the genome, or it changes the expression of the genome, which is epigenetics. So I started to come alive, and my results were stunning as I went to this new level of kind of digging into what I consider a deeper root cause than we'd ever gotten to before.
So I think we can interject a pretty simple example here for folks to get an understanding, and that's with the VDR gene that I think we both share. That's a vitamin D receptor mutation, and you know, we both live in Florida. You're blessed to live in the Florida Keys at this point. Congratulations for that. But we tend to get a lot of sunlight, and you know, we probably are both taking vitamin D supplements. And I noticed that, you know, gee, I'm getting a ton of sun, maybe too much sometimes, and I'm taking a fair amount of vitamin D. Why is my vitamin D level on the blood test not higher? And
exactly,
you know, thank you for explaining that to me, because now I kind of know how to better manage that so that my levels will stay up. And it's extraordinarily important, I think, at this point in time with the COVID virus to have adequate vitamin D levels. So there's a very simple example of how genetics, a little knowledge of genetics can really be a powerful help for you. So,
yeah, 100%. That's one of my favorite genes to talk about, and it does explain that concept. You know, so I was seeing the same thing. I'm looking at my patients and I'm going, wow, their vitamin D levels, you know, on the blood work is really low. Obviously, we need to give them vitamin D. Not so obvious. You know, no matter how much vitamin D I gave them, that number didn't budge, and it didn't make sense to me. And
yeah, one person who doesn't have that VDR mutation, they might come up 20 points in a month, And you're coming up, 5 or 6 points, and it's like, something's not quite right here, and it's the gene. So
Exactly. Yeah. So that's the vitamin D receptor. So if you have a genetic variant there, you can't absorb vitamin D. That's the problem.
mhm.
So taking more vitamin D is not going to solve it. It's how do we get that receptor working better is a better question, And so that's where
Yeah.
I dug in there. That was the first gene I saw on myself when I got my genes tested, that I had a homozygous variant. In other words, like one gene from mom, one gene from dad. Both of them are a variation from normal. So my VDR, my vitamin D receptor gene, is reduced in its function by about 70%. My ability to absorb vitamin D reduced by about 70%. And that's a big hit, as you say, with your immune system, with brain chemistry, with cancer risk, all the things that vitamin D, that we know that vitamin D is involved in, or deficiencies can be involved in. I couldn't figure out what do we do with that, So that's where the kinesiology was so instrumental, because when I'd put vitamin D on somebody, they would go weak. Somebody whose vitamin D is like 13 and they're going weak on vitamin D, and that had never made sense to me until I understood, they have that gene.
Yeah.
And then I started playing around with cofactors, reading everything I could get my hands on with how do we get that enzyme to work better. And that's where we came up with, the vitamin K and the A had to be in there. And then vitamin D tested good. And then when they took them in combination, suddenly their vitamin D levels, really went up. So it was like, wow. And here's the cool thing, Bill, I'll keep it short, but when you have a vitamin D receptor variant like that, you can't fight infections. So yeah, you're very susceptible to COVID or Epstein-Barr virus or other chronic infections. And that's what happened to me was when I started working with my vitamin D receptor, my 40-year-long bout with chronic fatigue syndrome, gone. My lifelong bout with depression, gone. And it was very quick. It was within a week or two that I felt like a completely different human being when I understood that one gene and started working with it. And so that got my attention.
It's almost like somebody discovering fire, isn't it?
Yeah, totally. Yeah.
Really, yeah.
Oh my
So
gosh.
I saw you present in Phoenix earlier this year, and you did an impressive analysis on one of the participants who was, having some difficulty. And during that, you incorporated, all this knowledge of genetic variants with some of Dr. Wally Schmidt's work. And, Dr. Schmidt is a friend of ours and been, powerful influence on so many people. So how did you come up with that combination of methods, and what's the value of this kind of conflation of technique?
That's a really good question. I think, it's hard to really put into words, but, he was a big mentor of mine, and it was really cool because I got to listen to him when he would come to New Mexico. He would do the Ski with Wally seminars up in Taos, and only about 5 people would show up. I'm like, oh my God, this is like a world-class presenter. There's 5 people here. You got some really quality one-on-one time with Wally, and you got some secrets that probably, the big groups didn't get. And so it just became a part of who I was, how I practiced, the injury recall techniques, and the, not verifying muscle testing with muscle testing, and the biochemistry that he taught me. That was all like just, I just couldn't get enough of that. So I can't help but, it's there. It's, it's just there in my physiology, so that when I go to look at how do we work with genetics, I can't help but incorporate that kind of knowledge into how do we verify what we're seeing with the genes, and how do we use kinesiology to test for the presence of a genetic variant. So I'm not sure I can put into exact words how that worked in there, but he deserves a lot of credit for my education.
Well, I can tell you that was a very impressive analysis of that patient, and I can also tell you that Dr. Schmidt was pretty happy and impressed with it. So because we were talking during and after that, so congratulations on getting that put together. Can you tell us a little bit about some of the other things you created in conjunction with your genetic program? I know you've got a lot of different moving parts to this. And you've
Yeah.
designed this interactive chart, which I've seen and used to a certain extent. Can you tell us a little bit about that? Because I think that's some powerful tool and very innovative. So let's hear a little bit about that. Thank you.
Okay. Thank you. Yeah. It was really it was a learning tool for me. You know, I started to look at these pathways. Methylation. I didn't even know what that was when I first started this. What is methylation? And I started digging into it, and what I realized was that it wasn't something that was covered in our education. I knew about the Krebs cycle. I knew about electron transport chain, detox pathways a little bit, but like, wow, how does I looked at Amy Yasko's map first, and then started expanding on it, put in Wally's work, put in Dr. Axel Smith's work, and this thing came alive. And I was like, I don't have a very good memory. I'm not one of those photographic memories. So I wanted to create a learning tool that could remind me, what's that molecule do? What does that gene do? So it's each piece of this pathway, you click on it, it'll pop open. It'll give you an explanation of what it is. What does tryptophan do, and how does it turn into dopamine? What is dopamine, and how does it turn into adrenaline? What enzyme is involved? What genetic variant? It's all in there. And so when you pop open these balloons, let's say you're working with a VDR, you click on the VDR, you can kind of see that map there in that picture. You click on the purple balloon, it'll open up and it'll give you this description of the vitamin D receptor variants are associated with these particular disease processes or risks of disease processes if you inherit that. This is your kinesiology challenge. These are the nutrients that you can use to kind of work with it. So it's an incredible amount of information in there, and it keeps growing. Every day I work on it because I love it. It was meant for me, but all the doctors are like, that would be cool. It turns out, it's a great practice tool for a lot of people. So as they're working on a patient, they go, what's that VDR? You're telling me I have a VDR? What does it do? Bam, they pop open that balloon, and then there's a description right there of everything that it's associated with. So it's become a labor of love, and it's been about 6 years of working at it almost daily. I'll tweak it, add more information in there. And this is one thing I wanted to work with you on. I want to add the blood work in there. So, with the vitamin D receptor, obviously you want to check, your vitamin D levels. And so you and I talked about maybe doing a panel that fit, this information, and it could give you
yes, and
direct feedback.
I'm going to contribute everything I can to this effort because I think it's an absolutely astoundingly good and useful tool. And by the way, this is Dr. Dunn here teaching, as she's done so often. And this is this chart she's designed, and this thing lives, folks. It does things. It opens up and expands, and it relates to one another. It's really an amazing, innovative piece of information that she's put together. So I highly recommend that we do a little bit more with this. And you can find more about Dr. Dunn here at holisticmethylation.com. And this is her very stylish logo that she has on her website, done with the double helix there, really nicely done. So congratulations on all of those things. And let me just go back for a second because I did fail to, I think, give our disclaimer here that this should not be taken as medical advice, and it's left to your responsibility to decide whether it's appropriate for your use and that sort of thing. So please be aware of that, and let's get back to some more interesting stuff. Maybe you can tell us, we already heard a little bit, but maybe a couple of your favorite genetic snippets that you find interesting and love to work with.
Yeah, well, you mentioned metabolic syndrome, and this is a big kind of piece of what we work with, the underlying causes of that. And really it comes down to the Krebs cycle and the electron transport chain. So I really love working in this area because this is where, weight gain happens. This is where, the blood sugar imbalances happen. This is where energy, is just, fatigue is our number one thing that we get in our office, complaints of fatigue. So understanding that entire pathway, how, gluconeogenesis and glycolysis, how does our body take nutrients in and make energy out of it? If there are genetic variants anywhere along that pathway, you're going to have weight gain and fatigue. So this is where epigenetics really comes in too, where our environment can have a real effect on our ability to make energy through mitochondria. So this is an area that I am madly in love with and madly, trying to figure out to the best of my knowledge how to work with that, because I think it's huge. Diabetes, metabolic syndrome, as you mentioned, blood sugar issues of all kinds, insulin resistance I think it's our number one killer. It's associated with, cancer and diabetes and et cetera. You could probably go on and on about that.
Let's be factual here. 30% of the adult population in America has definable metabolic syndrome, and there's a whole lot of others that have pieces of it going in the wrong direction. So it's no doubt the number one healthcare issue that we face. It's very much related to diet, and as you've just heard here, hot off the presses, genetics have a role in it too. So
yeah, very much so.
So we're really happy to be having this information for our group today. And what's on the horizon for you, and what are the things that keep you motivated? I think we already know some of that, but tell us again, if you will.
Yeah, well, this my next big project that I'm super stoked about is called My Happy Genes. And because my brain chemistry was an issue for my entire life, and it was so dramatic a change from always depressed and always working on my attitude and trying to be happy, trying to have a good attitude, to I don't have to work at it anymore. My brain chemistry is so balanced that I stay in Happyville, which is a much better place to be. I created a program called My Happy Genes, and it's really trying to focus on people's brain chemistry issues. So anxiety, depression, ADD, PTSD, addictions. We're seeing incredible work, incredible results with getting people unaddicted. It's stunning when you get their brain chemistry balanced through understanding methylation and the related pathways, including VDR is one big one here. When you flood the brain with dopamine, you no longer have those cravings. So I'm very, very excited about this piece, and we're rolling it out to the general public. But we also have a practitioner's portal where the treating of that, this will give you information like you're at high risk for PTSD, or you're at high risk for opioid addiction, or you're at high risk for depression. Those are your genetics. That doesn't mean you're doomed. We're going to send you to a practitioner who's well versed in this, and the rest of the program spits out a diet based on your genetics and supplementation based on your genetics. And so this is going to bring my work into accessible to people who don't do muscle testing. So what I tried to do was this algorithm of, you got the genes, you got what they call hub genes that are in your biochemistry that we just talked about, your glycolysis or methylation or detox, and a symptom questionnaire. So if you have a gene that you've inherited a variant in, it doesn't mean you're doomed to whatever that is associated with. Not at all. Your diet, lifestyle, everything has a chance to modify that expression. So we look at, are you expressing that gene? Do you have insulin resistance? Do you have blood sugar issues? Do you have depression? Do you have fatigue? We calculate all those symptoms that point to a particular pathway, and then it'll spit out supplement recommendations. So it's going to be very turnkey for doctors that want to do the genetic stuff. They just don't have the time. They don't have the time to study this, to get into the interactive chart or really dig in deep here. It's pretty dense. It's a dense topic. Like biochemistry and genetics themselves are really dense. So it's a turnkey approach. It's like I downloaded my brain into a software program. Got these great programmers who put all these algorithms in, and eventually I want to put the blood work in there too, Bill.
Well, that sounds like an amazing project and an amazing goal. So yeah. Thank you for sharing your thoughts on that, and congratulations on coming to the point where you feel you can put all this together, because it's powerful stuff, and we all need really awesome teachers like you've had in your life and I've had in mine. And yeah. I think you've become that for this sector of the genetic issues, and lots of people need and want to know more. So we're going to hope that you'll do some sharing on webinars for us.
I would love to, yeah.
And a lot of other places as well, because I think what you have here is something that really needs to be shared. And let me get to the most important and most asked question that we have here. Very important. And what does the J stand for? in J. Ann Dunn.
I knew you were going to ask that. That's my real name. That's what I got. I was born with that. So my mom wanted to name me Jan after her best friend. My dad wanted to name me Jackie after my mom, and they could never agree. So they just gave me the J on my birth certificate, and it gets kicked out. And people are always asking me, "What's your real name?" It's okay, you can tell me. Like, nope, that's it. That's all I got.
So the mystery has been solved, folks. A mystery no more. Thank you for letting us know that, Jay.
Yeah.
Anything else you'd like to share?
Gosh, I don't know. You know, if you want to learn more, holisticmethylation.com, we got a bunch of webinars we've done there. So if you're interested in, you know, an overview of methylation or the VDR that we just talked about, or some of the other genes that you asked about, one of them is COMP, MAO. It has a lot to do with personality. There's a webinar on that. There's a webinar on this electron transport chain and Krebs cycle there that really explains how, you know, how you can have genetic variants in turning your food into energy, essentially. So lots of learning there, and go on My Happy Genes and see if it appeals to you. And I would love to come back and do more with this, Bill. I appreciate you so much. This series has been really educational and interesting, and I think you're doing it out of the kindness of your heart. You know, so thank you so much.
Thank you for that. It's all about sharing the information, and I just hope people take advantage of this. And you just heard that there are some things you can watch for free that Dr. Dunn will allow you to watch, and I think that's a pretty amazing offer. So thank you so much for sharing all of this and your experiences and insight. We love and appreciate you, and hope that you will do more with us, and keep on doing what you're doing, because it's helping a lot of people and it's great work. So thank you very much, Dr. J. Dunn.
Thank you so much, Bill. This has been fun.
And we'll see you again sometime soon. Thank you for watching, Professional Co-op members, and have a wonderful and healthy day.
Thank you. You too.